Why do trauma specialists use trauma-informed care now? Imagine a world where healthcare providers see beyond symptoms and diagnoses to truly understand what someone has been through. That's the core of trauma-informed care. Trauma specialists now use this approach because it's backed by solid research and helps address the deep effects trauma has on a person's mind and body. Trauma, including conditions like post-traumatic stress disorder, affects a large part of the population. Studies show that about 70% of adults in the United States have experienced at least one traumatic event, and around 6% develop PTSD. This means trauma influences how people respond to treatment and how they manage their health overall. Trauma-informed care shifts the focus from asking, "What is wrong with you?" to "What happened to you?" This change is vital because it promotes understanding, safety, and empowerment. When trauma specialists recognize the signs of trauma, they can avoid practices that might unintentionally trigger distress or worsen symptoms. This approach creates a safe space where patients feel trusted and respected, which is essential for healing. Building trust helps patients engage more fully in their treatment, making recovery more effective. Creating a safe environment is a cornerstone of trauma-informed care. Many trauma survivors have heightened sensitivity to perceived threats, which can make them anxious or resistant to treatment. By establishing physical and emotional safety, trauma specialists help reduce this anxiety. All staff are trained to interact with compassion and respect, ensuring that care does not cause re-traumatization. This universal precaution means everyone involved understands trauma's impact and works together to avoid harm. Empowerment is another key reason for using trauma-informed care. It encourages patients to take an active role in their healing process. Respecting cultural, racial, and gender identities helps tailor care to each individual, fostering a sense of control. When survivors feel empowered, they are more likely to trust the process and develop resilience. Trauma-informed care also emphasizes collaboration, making sure patients are partners in their treatment rather than passive recipients. Supporting healing and resilience is at the heart of this approach. Trauma specialists aim to foster nurturing relationships and environments that promote recovery. This is especially important for children and adolescents but benefits individuals of all ages. Stable, caring relationships provide a foundation for healing, helping trauma survivors rebuild trust and regain a sense of safety. Finally, trauma-informed care aligns with the best available scientific evidence. It incorporates proven treatment methods like trauma-focused therapy, which has been validated through peer-reviewed research. This ensures that care is not only compassionate but also effective and safe. It avoids unproven or harmful therapies and emphasizes personalized treatment plans based on each person's unique needs. In essence, trauma specialists use trauma-informed care now because it is a scientifically supported, compassionate way to help people heal from trauma. It recognizes how widespread trauma is and how deeply it affects health. By focusing on safety, trust, empowerment, and resilience, trauma-informed care helps individuals move toward recovery in a way that respects their experiences and promotes long-term well-being. Always remember, if you or someone you know is dealing with trauma, consulting qualified healthcare professionals is essential for personalized and effective support.